A very good afternoon and welcome to our session on a very important topic, which is IUI or IVF. Who need what? We are glad to have our doctor Sita Sharma among us today to help us understand the topic. The doctor will help us understand more in detail and importance of both of the treatments where people get confused. I think in today's webinar, we can have a lot of questions and a lot of doubts. So if you have any, just put it in the comment section. Our doctor is there to answer all your questions. Doctor, you have the stage.
Thank you. Yeah, good afternoon, viewers. And today's talk is very important. And it is very important to know what is IUI and what is IVF, because the patients are coming to me and they do not have any clarity what is IVF and what is IUI. They consider IUI also as a IVF procedure, but they are two are different in that way because they do have different indications. These are IUI is done in a different set of indications and IVF is done in a different set of indications. So let's understand how does normal conception takes place. These IUI and IVF, these are the procedures which are assisted reproduction techniques, and these are used in patients who are facing the problem of infertility. Infertility is nothing but inability of a couple to conceive after trying for 1 year of regular unprotected intercourse. If a couple is trying for pregnancy and they are not using any kind of contraception, they are trying for 1 year, we label them as infertility. That means now it is time that they need some help from the fertility consultant. And if in this case, if the age of the woman is less than more than 35 years, then we take this period as 6 months. So after 1 year, or if in case of 6 months, in case of 35 years or more of age in female partner, then it is taken as 6 months. After this period, we start investigating the couple. And first is natural conception. We tell the patient how does natural conception takes place, and we do counseling of the patients after some routine investigations, after the proper history, their timings, whether they are having relations at proper time, or some couples even do not have relations once a week. So we have to guide them accordingly for natural conception. If natural conception is not taking place within a proper time and period, patients are following our advice, even then they are not able to conceive, then we switch over to the ART procedure. And IUI is a very basic procedure and basic and first level of ART procedure, assisted reproduction techniques. So let's understand how does the natural conception takes place. Then it will be very easy for you to understand who needs IUI and who needs IVF. And what are the success rates, I'll be taking one by one. So I'll just show you, this is just a in diagram to show that what is the female reproductive system. So female reproductive system consists of, this is the uterus, these are two fallopian tubes on one side, this fallopian tube, and these are the fallopian tubes, and there are two ovaries. This is the ovary, right ovary and left ovary. These are the fallopian tubes. So this is the uterus. Uterus has a contact with the outside world, that is vagina. This is the part of the reproductive system where during the sexual intercourse, the semen is deposited in the upper part of the vagina. The male partner should be capable of depositing the semen inside the female body. A male should produce a good quantity of healthy motile sperms, and these sperms should reach the female body. So during the menstrual cycle, the egg is released in the ovary, and this egg is picked up by the fallopian tube. During the menstrual cycle, in the mid portion of the menstrual cycle, in between of the periods, the ovary, one by one, ovary releases the eggs, and this egg is picked up by the fallopian tube. The fimbria of the fallopian tubes, they are just like our fingers. They are just like, they are lying over the ovary like a wicket keeper. So when the egg is released, the fimbrial end of the tube picks that eggs. This egg reaches the mid portion of the fallopian tube. Now, during the physical intercourse, then the semen will reach at the upper part of the vagina, and they will travel through the cervix. Cervix is mouth of the uterus, through the uterus, and then they will reach the tubes. And tube is the site of fertilization. So that is the importance of fallopian tube. Fallopian tube will help. It is the site of fertilization where egg and sperms meet, and after 5 to 6 days, this embryo is after the egg and sperms fertilization, the embryo is the, you can say, ankurit baby. जो baby है that will reach the uterus, and this is the endometrium, inner layer of the uterus, where this pregnancy will, this embryo will implant, and this is the site of implantation, and then you will miss your periods and your pregnancy test will come out to be normal. So if a patient wants to conceive, the female partner should have healthy uterus, healthy tubes, healthy ovaries which are producing eggs, and male partner should be able to deposit the semen inside the female body, and male partner should have good quality of semen or sperms in number. So this is how the natural conception takes place. And then, and if there is some kind of difficulty, couple is experiencing some kind of difficulty, not able to conceive, then we assist them with some medicines and with some procedures. Now, what is IUI? इंट्रायूट्राइन इंसेमिनेशन. IUI की फिल फॉर्म है इंट्रायूट्राइन इंसेमिनेशन. दैट मीन्स वी आर इंट्रोड्यूसिंग, इंसर्टिंग समथिंग इन द uterine cavity, and that is the semen. Husband's semen is, we are using it, we are preparing it, and we are putting it inside the uterus for ovulation. For IUI कौन से पेशेंट्स में करते हैं? नंबर 1, जैसे मैंने अभी बताया कि दिस इज द ट्यूब शुड बी पेटेंट. नेचुरल कंसेप्शन करने के लिए ट्यूब्स खुली होनी चाहिए. अब जब हमने IUI करना है, व्हाट वी डू इन IUI, वी आर जस्ट असिस्टिंग यू इन ए नेचुरल वे. नेचुरल साइकिल में एक कपल के कंसीव करने के 6 to 8% साइकिल, एक साइकिल में चांस होते हैं. व्हेन वी आर डूइंग IUI, these chances become 15 to 20%. And what happens? We do ovulation study. The ovulation study is just knowing that ovary is producing eggs or not, because ovaries are lying inside the body. We have to do serial ultrasound. Transvaginal scan is done to know the follicular monitoring. Follicle एक sac like structure है जिसके अंदर एग बड़ा होता है. जो एग है वो फॉलिकल का साइज धीरे धीरे बढ़ता है. यूजली वी स्टार्ट फ्रॉम द 9th and 10th डे ऑफ द साइकिल, एंड सीरियली वी स्टार्ट monitoring the follicle, and one fine day the follicle will reach 18 to 20 mm of the size, and then we see the vascularity, and then it is the time when we give an injection which is known as trigger. So after giving this injection we can time the IUI कि हमने IUI कब करना है. IUI करने के लिए एक इंजेक्शन दे दिया, उसके 36 to 40 आवर्स के बीच में हम लोग IUI करते हैं. IUI के लिए हस्बैंड का सीमन लिया जाता है, एंड दैट सीमन इज प्रिपेयर्ड इन द IVF लैब, IUI एंड्रोलॉजी लैब. सो जो नॉर्मल सीमन काउंट है वो नॉर्मल एक हल्दी मेल में 16 मिलियन पर ml तक होना चाहिए. मोटिलिटी 40% होनी चाहिए, और मॉर्फोलॉजी है नॉर्मल, जो स्पर्म्स दिखने में नॉर्मल है, मॉर्फोलॉजिकल नॉर्मल मोर देन 4% होनी चाहिए. ये तो है नॉर्मल. लेकिन अगर किसी हस्बैंड के अंदर माइल्ड मेल फैक्टर है, जैसे उनका काउंट 5 to 10 मिलियन के बीच में है, तो माइल्ड फैक्टर इनफर्टिलिटी है, उन केसेस में IUI रियली हेल्प्स. उसमें हम लोग क्या करते हैं, हस्बैंड का सीमन लेके हमारे एम्ब्रियोलॉजी लैब के अंदर एम्ब्रियोलॉजिस्ट जो है वो सीमन को प्रोसेस करते हैं. दिस इज नोन एज सीमन प्रोसेसिंग. दिस इज बाय एडिंग द मीडिया एंड मेकिंग द सीमन यूजिंग दैट सैंपल, because this sample will be free of debris, and it will be free of the dead cells, pus cells, dead cells, debris free हो जाता है. and healthy motile sperms जो हैं, एक छोटा सा कैनुला होता है, उसको IUI कैथेटर बोलते हैं, उसके थ्रू हम पेशेंट के यूट्रस के अंदर डालते हैं. दिस इज थ्रू द विजाइना. We put it inside the uterus and we release the sperms here in the cavity. So these sperms, now they will traverse the uterine cavity and they will reach the tubes fast, which is the site of fertilization, and the egg is already waiting there, because we have already monitored the female for the release of egg. We have already monitored the patient for the follicular monitoring. Now we have already given the injection, and we know that after giving the injection, after 48 hours, the egg is going to release. So the egg is already, or the egg is just going to release within 2-3 hours. So now this semen will be available in the female body for next 24 hours. So then the semen and the sperm and the eggs will meet. and that is the process of fertilization. So in this case, the fertilization is taking place inside the female body, that is inside the fallopian tubes of the patient, like it was in the natural way. But in the natural way, the semen, which was unprepared semen, it was discharged in the upper part of the vagina during the natural course, and now it has to traverse, and it has to traverse a long course. And when we do IUI, even in cases the male patients who have less number of sperms, we are helping those, and we are preparing the sample, we are making the semen sample more fertile, and then it is injected, it is bypassing the cervix, and it is injected inside the uterine cavity. So it makes almost double the rate of the natural course. If you are trying to conceive natural, the IUI is helping you, it is assisting you. So IUI is done in those cases where there is a mild form of male infertility, or there is mild to moderate endometriosis. Endometriosis is a disease in which the endometrium of the uterus, the lining of the uterus, is deposited outside the uterus, and that causes infertility. That is a cause of infertility in 20 to 30% of the patients. And in also in cases where some kind of infertility or potency factor is there with the male partner can give sample in the laboratory by masturbation, but male partner is not able to introduce the sample inside the female body because of some health issues. So in those cases, IUI is going to help, because we can take the sample in the laboratory, we can process the sample, and we can put it inside the uterine cavity of the female at the time of ovulation. And it can be done in those cases in which ovulation is a problem, like in PCOS patients. They have they are difficult patients for ovulation. We need to give them many drugs, and then they ovulate. In those cases, even the patient has a long standing infertility. When the tubes are open, only then we can go for IUI. We can do IUI 2, 3, 4 times also, because in patients of PCOS, they have a problem of anovulation. They find difficult in conceiving because of the ovulation problem, and once the ovulation occurs, we do not want to waste that time, and also the results are better with IUI. And we do not we do not prohibit the patient to have a regular intercourse after the IUI. After IUI, the patient can have relations even in the same day also. So that is not the issue. They will try conceiving natural way also, and IUI can help in those cases. So IUI is a basic assisted reproduction technique where the results are good if the age of the female partner is less than 35 years, because after 35 years the fertility potential of the female declines. Fertility potential of the females decline with the age, because the ova also age. The eggs में maturation हो जाती है, there are chromosomal abnormalities, the risk of abortions also increases after the age. So if the age of the female is less than 35 years, may it be IUI, may it be IVF, the results are going to be good. One tube of the patient at least should be open. So one fallopian tube at least should be open, and we do IUI at that time when, if it is right ovary, if the right tube is open, then we will do IUI at that time when it is ovulating from the right ovary. So at least one tube should be open, and the patient should be ovulating. All the three structures, uterus, tubes, and ovaries, should be normal in the female partner. So the ovulation should be there, ovary should be producing eggs, lining of the uterus should be good, and at least one tube should be open. So in those cases we can do IUI. The simple thing is, fertilization takes place inside the female body, inside the fallopian tube. That is what IUI is. Other indications where IUI can be done in some patients which do not, in male partner who is not having sperms, like azoospermia. If there is azoospermia, then we need to do IUI with donor semen. So donor semen is always taken from the ART bank, and we can do IUI in the female body, which is a simple procedure, and the cost is also not less. It is less, and it is not done under anesthesia. Patient comes, and we do all the required consent work and everything, format work is done, and then the patient is made to lie in the IUI room, and semen is prepared by the embryologist, and then the semen is inserted inside the uterine cavity. That is IUI. That is all about IUI. You can ask me questions, and at the end of the session I'll be answering all the questions. Now we move on to IVF. So what patients need IVF? If some patient have unexplained infertility. Unexplained infertility means the patient are trying to conceive. There is no problem with the male partner, no problem with the female partner. She is ovulating over, even fallopian tubes are open. She is producing eggs also. Even then, she is not conceiving. So in unexplained infertility, also IUI is the first thing to do. We do IUI 2 times, 3 times, even 4 times, depending upon the age and depending upon the history of the patient and depending upon the other social and economical factors also. So we are doing, and if we are not conceiving even with IUI, then we may have to shift to IVF even. So indications for IVF are mainly, number one indication is where tubes are blocked, because natural conception or the IUI is done when the tubes are open. If the tubes are blocked, that means now the tube cannot do its function, and the function of the tube is fertilization. एक साइड से एग आता है, एक साइड से sperm आता है, they meet in the tube, and then the embryo is formed. Then embryo is transferred, migrated from the tube to the uterine cavity in the to the at the endometrium, at the site of implantation. सो इफ द ट्यूब इज नॉट परफॉर्मिंग इट्स फंक्शन, ट्यूब की कोई आपकी कोई सर्जरी हुई है, पहले एक्टोपिक प्रेगनेंसी हो गई थी, एक पहले राइट साइड पे होगी फिर लेफ्ट साइड पे होगी, जहां आपकी किसी वजह से ट्यूब्स ब्लॉक्ड है, जहां आपको कोई स्वेयर फॉर्म ऑफ पेल्विक इन्फ्लेमेटरी डिसीज है, स्वेयर फॉर्म ऑफ एंडोमेट्रियोसिस है ग्रेड 3 ग्रेड 4, जिसमें ट्यूब्स भी इन्वॉल्व हो जाती हैं, जो ओवुलेशन ट्रैप हो जाता है, जहां पे एग्स और ट्यूब्स तक एग पहुंच ही नहीं पाता, जहां स्वेयर मेल फैक्टर इनफर्टिलिटी है। जैसे मैंने कहा कि अगर 5 to 10 million काउंट है, ट्यूब्स आर ओपन, तो देन वी कैन ट्राई फॉर IUI. बट इफ देयर इज स्वेयर मेल फैक्टर डेफिशिएंसी, लेस देन 5 million स्पर्म्स काउंट है, जहाँ मोटिलिटी बहुत कम है, जहाँ देयर इज मॉर्फोलॉजी नॉर्मल नहीं है, in those cases we have to go for IVF, and advanced form of IVF is ICSI. I'll discuss it later. So स्वेयर मेल फैक्टर है, जहाँ किसी की कपल की हिस्ट्री में जेनेटिक प्रॉब्लम है, तो जेनेटिक प्रॉब्लम है, दे वांट टू सी वेदर दिस बेबी इज गोइंग टू हैव सम जेनेटिक प्रॉब्लम और नॉट। उन केसेस में हम लोग IVF कर सकते हैं, जिसमें एम्ब्रियो बायोप्सी लेके बाद में PGT या PGDS के लिए जाया जाता है। सो दीज आर द सम कॉमन इंडिकेशंस जिसके लिए हम लोग करते हैं। और अनएक्सप्लेन्ड इनफर्टिलिटी, जिसमें बड़े टाइम से कपल ट्राई कर रहा है, इवन इन सम केसेस ऑफ PCOS विच आर नॉट रिस्पॉन्डिंग टू नॉर्मल ट्रीटमेंट, एंड नॉर्मल ट्रीटमेंट PCOS में ड्रग्स आ जाते हैं, इंजेक्शंस आ जाते हैं, लाइफस्टाइल मैनेजमेंट, द ओवेरियन ड्रिलिंग एंड सो मेनी थिंग्स. If they are not responding, then third line of treatment for PCOS is also shift to IVF. So what we do in IVF? In vitro fertilization, as the name indicates, the fertilization is not inside the body, it is outside the body. In vitro का मतलब होता है outside the body. So this जो काम ट्यूब कर रही थी बॉडी के अंदर, now this work is done by in the IVF lab by the embryologist. What we do, we call the patient and we do all that. We take all the history, all the investigations. The important investigation which we do apart from the routine HB etc. We look for sugar, we look for thyroid, we look for prolactin, we look for your ovarian reserve. Ovarian reserve is known by the ultrasound, transvaginal scan we do, and we count the follicles which are present in the ovaries. Ovaries contain small follicles. These are called antral follicles. These small 2 to 7, 2 to 9 small follicles, small sac-like structure, drop-like structures are there. We count them, antral follicular count in both the ovaries. And some patients have poor ovarian reserve, that their ovaries stop functioning, they diminish, the ovarian function is diminishing. That means the hormone level and also the ovarian, the follicles are declining in the ovary. We call them diminished ovarian disease. So in those cases, the follicle count is decreased, it is down the normal, and that is why the patient is not able to conceive. This happens usually in less than 35, more than 35 years of patient, but nowadays we are seeing at 29, 27 years of age group. where the antral follicular count is scanty, very low. And one test is there which is very important, that is AMH, anti-Mullerian hormone. AMH level, if it is less than 1.2, that is known to as a poor ovarian reserve. So ovarian reserve is also an indication for poor ovarian reserve, is also an indication for IVF. If poor and then the patient will see the patient for ovarian reserve, for the uterine lining, for uterus and anything, any कोई cyst या कोई endometrioma ovary के अंदर तो नहीं है, तो we will do patient scan on day 2, and then we'll do some test to know the patient's hormonal status, including thyroid, prolactin. We would like to know the husband test also, semen examination, semen analysis, semen culture, blood group of both the partners, then viral markers. And these tests are done as a prepare to prepare the patient for IVF. So, and IVF, basically IVF procedures have two portions. One is injections and one is the procedure. Injections are given from day 2 of the cycle to produce many follicles. In IUI, we give injections on tablets. First of all, we give in IUI, we give most of the time the oral drugs, tablets. Sometimes we can add gonadotropins, and then the follicle monitoring is done the same way. In IUI, we want 1 or 2 follicles to develop, but in IVF, we want as many as follicles present inside the ovary, they should develop. So we are giving in IVF, we are giving injections for 9 to 10 days with regular monitoring, with doing hormonal profile of the patient as and when it is required. And one fine day when we find that the ovaries now they have all the follicles are developed and the follicle has reached a particular size, then we give one injection which is known as trigger. And after that, after 34 to 36 hours, we will plan the pickup of the patient, that is called oocyte retrieval or ovum pickup. So in IUI, the egg was releasing inside the body naturally. Now we are taking out all the eggs in the IVF OT. So we call the patient empty stomach with all the requisite work, anesthesia work. Patient is taken in the OT, and we under ultrasound guidance, we remove all the eggs from the patient's ovary, and these eggs are released in a proper techniques, ovum pickup technique, and they are then given to the IVF lab. IVF lab, the embryologist will see the fluid, the oocyte fluid containing the eggs, and then these eggs will be husband's semen is also taken on the same day, and these eggs are made to fertilize by the embryologist in the laboratory, which is called IVF. One egg is then put in the petri dish, and the semen is made to lie on this, and then the healthy sperms will penetrate the egg, and then there will be fertilization. Then these things are kept, these with the petri dishes containing the egg with the semen, these are kept inside the incubator, and they are monitored for further progress. So if this is called IVF, when one egg is there in the petri dish and the semen sample is put on it, and the semen sperms will find its way to the egg, and they will reach the inside the egg, and there will be fertilization. So from the one cell they will start dividing, and this is on the next day the embryologist will see those eggs, fertilized egg, and that will confirm that fertilization has occurred. On the then day 3 there will be 8 cells formed. So 1 cell, 2 cell, 4 cell, and then they will divide to form 8 cell. We call it as 8 cell embryo. And then we want to wait till day 5, that is blastocyst. Blastocyst, the best embryo which is formed. So it has survived all the cultured media and all the media and all the days till 5. So this quality day 5 embryo is considered to be the best quality embryos. So now we will insert the now the second procedure is embryo transfer. Once the embryo is formed, then we would like to see where you will be agree with me that you will once you come to the fertility clinic, you must be familiar with 2-3 terms like egg, sperm, endometrium, embryo. So egg and sperm has fertilized, and now the embryo is formed. Now this embryo has to be positioned inside the uterine cavity in the endometrium. So we would see if the lining of the uterus, that is the endometrium, is good, it has formed good, it is good vascularity. Now we will do your fresh transfer in the same cycle, or if the lining is not good, we will freeze the embryos and we will make your plan for transferring the embryos in the next cycle. This is called frozen embryo transfer. So in those that cycle, we will only make the endometrium, we will only try to make the beautiful endometrium, so that the embryo transfer is done and the pregnancy test comes out to be positive. So ovum pickup and embryo transfer, these are the two procedures which are done in the IVF, in a patient who is undergoing IVF. So after giving injections, after trigger, then we'll plan ovum pickup, and eggs are transferred to eggs are handed over to the embryologist in the IVF lab. And in the IVF lab, this fertilization is done by the embryologist, and then this is happening inside the petri dish or inside the laboratory. That is it. That is why it is called in vitro fertilization. And in some patients where there is a severe male factor problem, like there is much less count, like say in thousands or in 1 million count. So in those cases, sometimes we offer them ICSI, intracytoplasmic sperm injection. This is a discretion of the embryologist, which where to decide for the ICSI or where to decide for the IVF, depending upon the number of eggs we are hanging, depending upon the quality of eggs. Sometimes all the eggs or all the oocytes we are getting are not of good quality. We always want a good quality egg and good quality sperm, so that we give you a good quality embryo. And a good quality embryo, once it is implanted in a good quality of the endometrium, the result can be positive. So in the embryo transfer, in the IVF, the results 35 to 50% of positive results are there. So in the IUI, the results are only 15 to 18% or 15 to 20%. When we are doing IVF, the results are almost becoming the double. So IVF ICSI can be done in those patients. ICSI is intracytoplasmic sperm injection. What happens, the embryologist do, the embryologist is using a specific machine for ICSI, and one egg is taken and one healthy sperm is taken, morphological normal sperm is taken, and it is injected inside the egg by the embryologist, so to ensure fertilization. So this is called intracytoplasmic sperm injection. So this is done in those cases where there is a very severe form of male infertility, or in some patients where the egg count is very low, and we want to ensure infertility, we want to ensure that fertilization. So in those cases, the ICSI can be done. So this is, and in some cases of azoospermia, where we are taking the sample from the male testes, that is PISA. So that TISA and TISA, and those cases we are taking the semen sample from the male partner testes, and we do not have much number of the sperms in those cases. So then the embryologist like to perform ICSI in those cases. So I think that is all about IVF and ICSI. And sometimes it is not like it happens in films that IVF is done and you are going to get 100% positive results. Look, we should think in a realistic way. This is a science and we are helping you treating your problems. So sometimes there can be fibroids, sometimes there can be severe endometriosis, or there can be some hormonal issues. So those cases, they can lead to infertility, and I think you should always visit fertility doctors to guide you that you can go for natural conception, or you need IUI, or you need IVF. So all the techniques are there, and we can help the patients in all the ways. Many patients, like for example in PCOS, if I advise the patient to go for weight reduction and lifestyle change, many patients conceive with that. Many patients will be needing IUI, the test can be positive with IUI, and in some cases we need to go for IVF. So one procedure is not for every patient. We have to counsel and we have to individualize the patient's requirement. So where we need IVF, where we need conception, natural cycle, where we need IUI, that will be done according to the patient's history, patient's previous record. If she is previous IVF failed or previous IUI failed, or there is tubal pathology, or patient has some ovulation problem, or there is some premature ovarian failure kind of thing. If there is premature ovarian failure, then the patient will be needing donor oocytes. The donor oocytes are taken from the ART bank. The donor is in this case, the eggs are taken from the donor, and with the husband's patient's husband semen, then this egg is fertilized, and these embryos, they are made, they transferred in the recipient, that woman, and then they in the uterus of the woman. So this is also another indication where we go for oocyte donation. Some patients have early menopause, and they do not have eggs in the ovary, because if you reach at the age of 40 years, your follicles number of follicles decline to 1000, and you are just having 10 to 15% of the success rate with IVF. So there are many factors on which this success rate of the IVF will depend. So one kind of treatment cannot be for everyone. We have to individualize the treatment options. We have to see the patients. We have to follow the patient's reports, previous history, and what are the further requirements, even for male partner and female partner both. Thank you so much. I hope I am able to clarify what is IUI and what is IVF. If there are any questions, I am here to answer those questions. I think there are no questions. Thank you so much. You can type your question in the chat also, and I can answer them later on. Thank you so much. Thank you.